A brown spot on a tooth can have several causes and should be processionally evaluated. A dental professional examines the tooth to determine whether the brown area is staining, decay, or another condition. In this example, the brown spot represents localized tooth decay, although some brown spots may simply be surface stains. If restoration is appropriate, the affected tooth structure is carefully removed while preserving healthy tooth tissue. The prepared area is cleaned before placing the restorative material. A tooth-colored restorative material may then be placed to rebuild the treated portion of the tooth. The restoration is shaped and professionally set to recreate the tooth's natural contour. The completed restoration is polished and carefully checked for appearance and function. When a brown spot is caused by decay, professional restoration may restore the tooth. The appropriate treatment depends on the underlying cause. This video is for general education only. If you notice a brown spot on a tooth, consult a qualified dental choir professional evaluation. Not all brown spots are caused by tooth decay.